Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. The research I'm citing today was published in the International Journal of Nanomedicine in January of 2018. The study helps explain the relationship we've seen in previous studies between higher blood vitamin D levels and a lower risk of developing high blood pressure, as well as improved heart function and a higher level of cardiorespiratory fitness in those with higher vitamin D blood levels. As well, a 2017 study published in the Journal of Clinical Diagnostic Research reviewed the study showing that lower vitamin D levels also increase the risk of stroke, and that providing stroke patients with vitamin D in the first few days after a stroke, so they get their blood levels to a more optimal level, was shown to result in better functional outcomes over a 3-month period with fewer deaths and disabilities. To date, 2 vitamin D intervention studies have been undertaken with stroke patients, and both have shown very impressive outcomes. So how does vitamin D help guard against high blood pressure and stroke and improve cardiorespiratory fitness? Well, in the 2018 study, researchers were able to show that vitamin D increases the release of nitric oxide from the cells that line the inner blood vessel wall. And this was one of the ways that vitamin D is postulated to help improve cardiovascular health. You see, it's known that nitric oxide is required to dilate or open up blood vessels to allow more blood to circulate more easily. In turn, this reduces the resistance to blood flow, which helps to keep the diastolic blood pressure down. The decreased resistance to blood flow also makes it easier for the heart. The heart doesn't have to pump as hard. And so the systolic blood pressure, the force of contraction of the heart, is also lowered. So increased dilation of arteries also brings more oxygen and nutrients to muscles that are exercising, which likely explains the improved cardiorespiratory fitness found in people with higher blood levels of vitamin D after all other factors are controlled for. So a blood vitamin D level at or above 32.4 nanograms per milliliter or 81 nanomoles per liter has been shown to be associated with a lower risk of developing high blood pressure. Now, these findings were discovered upon data analysis of the very large National Health and Nutrition Examination surveys, and show that after controlling for all other critical factors for cardiovascular disease, like the person's age and their sex and their race, smoking, alcohol intake, are they overweight or underweight, what's their physical activity like, do they have diabetes, what's their total cholesterol to HDL ratio, what about the inflammatory markers in their bloodstream, what about kidney function. After you control for all those factors, simply having a higher vitamin D blood level was associated with better cardiovascular fitness performance and reduced risk of developing high blood pressure. So the 2018 study in the Journal of Nanomedicine suggested that at least some of these results are made possible via the action of vitamin D on stimulating the release of nitric oxide from the cells that line the blood vessels. In turn, this opens up the blood vessels, allowing more blood to flow and lowering the resistance to blood flow that otherwise causes blood pressure to rise. So if you haven't done it yet, see your doctor and get your blood vitamin D level evaluated. The goal is to achieve a vitamin D blood level that's at or above 30 nanograms per milliliter or 80 nanomoles per liter, depending upon, in what country you live and how the lab tests come back. You want it to be at or above 30 nanograms per milliliter or 80 nanomoles per liter. Of course, you need to guard against vitamin D toxicity, so you don't want a blood level of vitamin D to rise above 100 nanograms per milliliter or 250 nanomoles per liter. But most people don't have blood levels that high. It does appear, however, that having optimal vitamin D blood level is one more way to support and enhance your cardiovascular health. So I've included the featured research paper in the text below, as well as links to other studies showing the relationship of vitamin D to cardiorespiratory fitness, lower risk of developing high blood pressure, and stroke. So get your vitamin D levels checked. Make sure you get it into that ideal range. So thanks for watching, and I'll see you next time.